Hello, Johnny. How are you?
I'm fine.
Thanks so much for coming out today. Can you please introduce yourself and the company that you work for and what you're doing in the digital health space?
Sure. So I'm Ranjani. I'm from Equity Digital Private Limited, which is the global partner for eGovernment's foundation. So we have built a digital public infrastructure for health campaigns management. So it helps in managing the way it's an end-to-end campaign management tool, which kind of drives efficiency and effectiveness of the way in the way campaigns are conducted across. And so we are kind of doing the implementation of that product across various countries in Africa.
That's fantastic. Can you tell us a little bit about a case study of showing what the power and the positivity of a campaign and how it's transformed a health sector and in which country?
Yep. So we've been working very closely with Mozambique. So that has been our pilot country. And we started off with a BedNet campaign in a couple of provinces. And as we speak, we've moved from a BedNet campaign to an SMC campaign to an IRS campaign. So we have really evolved. And like I said, the product has been built based on concepts of digital public infrastructure. So that's how there are registries that has been created in each of these campaigns, which are now getting reused and kind of reducing the cost as well, right? For example, in the BedNet campaign, we had the registries for the households created, and for the IRS, it's the same household data that's going to get used, and there's no need for the population, the campaign workers to go and register households again. So that's one use case. The second has been the availability of real-time data with our systems. The countries have been able to, the country, in this case Mozambique, has been able to take real-time decisions during the campaign itself. Say, for example, with our maps on the dashboards that's available at the national level, they're able to see which areas are covered better and which are not, and they're able to, extend the campaigns in specific areas rather than, an holistic, okay, let's just extend the campaign across. So I think it has helped the countries make make faster decisions on various aspects of campaigns.
That's a great example, and I love the fact that you talked about the growth that you've had within Mozambique. Success breeds on success. So if you had one piece of advice for people about how to have a similar success pathway as you have had in Mozambique, what would be your piece of advice to people?
I think, like as actually was mentioned in one of the plenary sessions, I think countries now should start thinking about digital public infrastructure. You should have some of the foundational assets like, registries for household, registries for beneficiaries, registries for your campaign workers, and kind of keep building on top of this. With that, efficiencies are brought in, both in terms of costs as well as in terms of campaign effectiveness, and that is going to make analytics as well better, like where you're able to identify for one beneficiary what are the different interventions that has been provided, and it helps the country much better with it. So I think it's time for countries to start thinking about digital public infrastructure.
I love it. DPI is fantastic. Final question for you. Focusing on 2025, what would be the 3 words that you want us to think about? What are they going to be the 3 trends, 3 big things, 3 things to give you hope for in 2025 in the digital health space?
At the risk of being very repetitive, I think it is the digital public infrastructure, not just from whatever I spoke about, but it's also going to help bring the private sector, the public sector, and make the possibility of data analytics takes it to the next level. So that's all possible with digital public infrastructure, and I'm thinking that's what we should all be thinking about.
Absolutely fantastic. Great way to finish. Ranjani, thanks so much, and have a great conference.
Thank you.